we're going to demonstrate how to do the multi-frequency VIA measurement here. Ideally, you want the arms adducted from the body at about a 30 degree or 45, that's actually about a 45-degree angle. And you'd like the thighs not to be touching. We anticipate that in many ICU patients, at least in the US, many will be obese. So you have a preparation of 3 rolled blankets, and you can place them between the arms to separate the limbs. So you just, so it's comfortable, but not, so that the arm isn't touching the torso, and that the thighs are not touching. So we just kind of place it between the legs and the arms like this. If the patient is really large, there can be some difficulty in getting that to happen while the limbs are still on the bed. So there are some adjustments that can be made. You can, it sounds a little improvisational, but you can use either a side table and move the patient a little bit so that they can, with blankets over the top of the table, as long as it's not a metal table, you can let them spread out a little bit. So I'm not sure how, you'll just have to sort of see how that goes in very large patients. What we do next is clean the hand, and we're going to, if possible, we're going to use the right side of the body. It's acceptable to use the left if there are logistical concerns like wounds or things that would prevent the electrodes from being placed on the right side. But ideally, if you can, use the right side. The most important thing is that you record what side you measure on, and then make sure that you use that side for all subsequent measurements. So I'm going to scrub pretty hard here, within reason hurt anybody, with an alcohol wipe. And often, just because you've got dead skin and other things in an ICU setting, that there could be any things that might be on the skin, you may go through a few of the alcohol swabs until it's clean. She here is doing very well, so we don't need to do multiple alcohol swabs. It's very drying, so you don't really want to overdo it. And I'm just doing the 2 places on the hand where I'm anticipating putting the electrode. We obviously in an ICU, people will be there for a while. You're hoping that they haven't had a lot of oils placed on the skin, because that can make it very difficult to get the electrode to stick. Now moving on to the foot. So you just want to get a good clean surface. And I'm going from bone to bone here, just to make sure, because I'm not sure exactly where I'll be placing. I mean, I have a pretty good idea where I'm going to be placing the electrode. Okay, and I'm going to use another one just to make it extra sure. And you want the alcohol to completely dry. It doesn't take long, obviously, to dry. You want to use these special BodyStat electrodes. You're going to use 4, 2 on the hand, 2 on the foot for each measurement that you do. So you'll throw these away at the end. They're disposable. So when I pull off the electrode, I'm going to try very hard not to put my fingers on the actual gel. And so you can do this by holding the outside. They're pretty stiff. And I've described this in the manual, but you basically are going to dissect the between the 2 bones, where you imagine a line going through, and you've just got to come up with your own consistent method internally to you, so that when you place an electrode, it looks right, because each person's going to have different anatomy, in terms of their where the bone is and how prominent it is. It can be a little difficult in a really heavy person to see those bones, so you can have them flex the wrist just so you can kind of see where their bone is if they're very large or have a lot of subcutaneous fat around that area. But so that's, for me, that would be a good placement. I also double check how well the electrode is sticking by just gently tugging on it, just to make sure it's not going to just come right off, because you want a really good adhesion there. And then, so the most important one is placing the one on the wrist, and I'll talk about the foot in a moment, but this is the first one you place because it's basically it's going to be your marker every time you go back. You're going to place that one first. We're going to do measurements after I get these placed so that we can have the same distance between electrodes for subsequent measurements. But I'm just going to look here, and I am essentially attempting to keep these two in alignment. They're not necessarily going to be parallel. I mean, they're usually they look a little bit like this. Shouldn't be angled. So essentially, I'm kind of the left, this side, roughly line up, as well as these two. And so that's a good placement. You don't want it on the fingers. We want at least 5 centimeters between the two electrodes. So when I ask you to measure the distance between the electrodes, I suggest doing it the same way every time. So whatever makes most sense to you. I tend to use the top edge to the top edge. So I say those are 7 centimeters apart, because this is a measurement that starts at 30. That's because it's a nice stiff measurement tape, and I'll see what I can do to provide measurement tapes to all the sites like this, because it's a nice stiff one, makes it easier when you're replacing the electrodes. But so I would record that as 7 centimeters apart for the hand. So again, I'm going to take a line, visual line. I'm standing over the foot, and I'm going to dissect that distance between the ankle and this way, essentially placing the electrode in the center. It's essentially, again, it's internal consistency in terms of exactly how you view that. That's good for me. And again, I'm going to check how well it's sticking. I've just pulled it up once. If you pull it up too many times, you'll have to get a new electrode, which is okay. Much better to do that than have it fall off. And then, again, the placement is just before the toes, roughly in line on this side. And it's, you do the best you can, obviously, okay, and it's stuck pretty well. So then again, to measure the distance between the electrodes, top to top. So in this case, it's roughly 9 and a little bit, 9.2 if you want to be, you're going to just have this so that you can try to replace them in the same general positioning for subsequent measurements. So 9.2 centimeters, and I would record that on the CRF. Now, to actually take the measurement, note that I've got the leads attached, ready to go. The most important thing, if you can show this, is that when you turn on the device, a test number comes up. So this is number 13. I'm going to make sure that I record that test number on the CRF, because if I don't, I have no way of tracking that data to this patient, this subject, right? So when we download the data later, it'll only come up as test numbers. You'll get a date and you'll get the data, and I'm going to ask at the end of every week, maybe you'll download the data from the device, because it's stored on the device up to 100 tests, so it's pretty good storage. And then you'll download the data, save it or get it into an Excel file, and I'll show you how to do that. And then you're going to insert a column that says subject study ID, and then you're going to type in Urvashi's subject ID next to the test number, so that we associate it with that test. So if you miss that, it's kind of a critical step. You need to record the test number from the device. And then this button here is basically to allow us to kind of move through the sequence to enter some of the data. And you're going to have a lot of fields that you won't have data for. First one is gender. So we've got female. If it were male, you just hit the buttons here, up or down, to adjust the number. But we've got female. Age, the default starts at 30, right? So again, what was she? How old are you?
32.
32. Okay. So if we go up to 32, it's very easy. These are very simple buttons here. And height, we'll just pretend you're 165 centimeters, but again, up and down to adjust that height. Weight, you can go to the 10th in terms of, if you're 65.4 or 5, 6 or whatever, you can go down or up like that. Okay, we'll just we're not really doing a real measurement here. And then activity, just skip it. So a lot of fields that you don't have data, for which you don't have data, just enter. Waist circumference, not important. Just let the default go in. You don't have to adjust those numbers. And so you can see now I've hit that about 7 times or so to get to where it says connect electrodes. Once I've attached the electrodes, then one more hit of that return button is basically go. It'll take the measurement. Okay? So it's a very simple device. Obviously, there's not a lot to it. So in placing the electrodes and the leads, I don't want them to be crossed. That's the main thing, is don't let them be crossed. Ideally, I've placed this device on a plastic table. I don't think there's a lot of metal on this thing. You really don't want to have a lot of metal nearby. So the beds are going to be well cushioned. I mean, there's not probably you wouldn't want to place it next to a device, like a computer. If you can have it be at least away, you just don't want it right next to some other electronic or metal device. So, and then when we place the electrodes, however you want to remember this, but I've got it in the manual as well. I can say red is furthest from the heart, if you want to remember that as a rule. So the red is always going to be distal on each of the hand and the foot. And so again, the red is furthest from the heart, and you don't, ideal if you can have it like this where they're not crossed, that would be ideal. You can always move the table if you need to. It doesn't hurt anything. And so we're ready to take a measurement. So at this point I would just tell the patient, please don't move. I'm going to take a measurement. Only takes a few seconds, but just relax. And so I'm taking the measurement now. I've just hit the return button and it's measuring, and it literally takes maybe 10, 15, 20 seconds, and it's done. Okay, so that's as simple as it is. We're finished now. You can remove the leads, and you want to just make sure that you're taking good care of these leads, because obviously we don't want to have to replace them. So you're going to put them away so that you don't pull or run into them. Now, I don't have to do any more with this screen. If I wanted to, if you had a patient that you had real data in there and you really wanted to let them know, although I don't advise it because it's potentially quite erroneous in terms of the percent fat, because this is a black box in terms of the equation that's used. But this is where the data are in here, and it's a lot of fields. So if I were going back and I had another patient and I had the device on, it's unlikely though. Really, that's not a likely scenario. Most likely is you're going to turn it off. But you could scroll all the way through. I'm looking at all of these different fields. This is all the data that will come into the spreadsheet that you download at the end of the week. Here are the impedance values. This is what we'll be using to generate. And we don't have a printer, so it says hold enter to print results, but we don't have one. That's fine. And then it says press enter for new test. So you just have to scroll all the way through and you'll get to the opportunity for a new test. But most likely what's going to happen is you're going to turn this device off. You'll go to the next room to do a new patient, and again, test number will come up for the next test. And so we had 13, the next test number is going to be 14. It's just sequential like that. So I'm going to go ahead and turn this off. Okay, so this is a little bit tricky, and does not have to be absolutely spot on. You're doing the best that you can to get these roughly in the same position that they were in the first measurement. So the way, now it's easy, right? Because right now we see where we needed to put it. But if you were doing a follow-up measurement, you would simply kind of eyeball where you think, and I've just, you eyeball where you think it needs to go. I think it needs to go a little bit back because we said 7 from the top to the top, so I'm just going to replace this. Sorry. It's not the easiest to do. So essentially, you're sort of, before you press it down too far, you're going to try to just get it a double check before you press that second time when you're doing follow-up visits. So yeah, that's what we mean by trying to get them as close as you can to the same distance apart. And so similarly on the foot, but I guess I don't need to show you that. Okay, thanks.